So this is a very exciting new area of multi-cancer early detection. Several companies are actually developing blood tests that can detect cancer in people who don't yet have cancer. And so I was asked to be a discussant for two abstracts. And there are actually many abstracts here looking at these multi-cancer early detection tests. The studies that we evaluated and discussed were two studies that were case cohort studies on large cohorts of individuals, some with cancer, some without, and they looked at how easily or how well they did at identifying a cancer signal in those patients with cancer who didn't yet have treatment. The interesting thing is that although some of these tests are being marketed and you can pay for them and patients are asking for them, we don't yet have clinical utility. We don't know quite how to incorporate them into our lexicon of cancer screening. We have 5 proven modalities to screen for cancer for breast, cervical, lung, prostate, colon. And how do we bring these tests into that is a little bit unknown. The issue, or one of the findings that we saw with these two studies, is that the signal detection rate for early stage cancer, stage 1 and stage 2, was quite low at about 25%. Even in the prospective studies, people who enter this study don't have cancer, they get this test, we follow them up. The ability to detect early cancer, stage 1 and stage 2, is still quite low. So I think although the promise of a blood test to identify cancer early is so intriguing and may actually be something that can be disseminated easily and widely, we still have a lot of work to do. We have to get better signal detection. The cost needs to come down. I mean, this could actually be helpful for countries where you can't set up mammography or low-dose CT or colonoscopy. So I think it's quite an exciting area, but it's still early, and really working on the clinical utility is the next step. There's going to be a large study funded by the NCI that will be a feasibility study of doing just standard of care screening versus one MCED test versus another MCED test. So the two companies have been identified. Enrollment will start in probably June. It is June already. And we hope to enroll 2,800 individuals to see if a large test like this can actually be done. And then we'll go to the next step, which will be a study looking at cancer mortality. Can you improve cancer mortality by doing a test like this?